It's a race to find more exposures after the Oregon Health Authority and Linn County Public Health investigated two cases of measles, the state's first of 2026. The cases have Lane and Linn County health officials concerned over the possible spread of the highly contagious virus.
An urgent search is underway by a team of nurses and health professionals in Linn County as they work to find anyone affected by the two patients who developed measles symptoms on January 5th.
One case of measles can affect up to 12 to 18 different people who are susceptible, meaning not vaccinated or don't have a previous history of measles.
The symptoms of the airborne virus include fever, cough, runny nose, red itchy eyes, and its trademark rash. Once found, officials say those affected will be given preventative care, but without herd immunity through immunization, those most vulnerable are at risk.
What we've seen is that 1 to 2 out of every 1,000 cases of measles have been fatal. And these are mostly in patients who might be too young to be vaccinated. It's a matter of time before, once we get a case of measles, then if not enough people are immune, it's going to spread and it's going to find those most vulnerable.
Both Linn and Lane County health officials expressed worry over the CDC's recent loosening of vaccination requirements for kids, potentially causing parents to question the need for vaccines.
I feel a little bit of hesitation when I'm asked to make a repair in my car or some sort of service that I don't know for sure it needs, right? The same thing goes for our body. So we understand and predict that people, if the federal government, if the Center for Disease Controls comes out and casts doubt upon an established medical practice, there will be people who take that and question. That questioning is not bad. But in the meantime, while you're doing that research, why don't you do the things that you don't have a problem with? Vaccination is one tool within that.
Despite the CDC's changes, Lane County says it will continue to follow West Coast Health Alliance's guidance for school vaccination requirements.
We do believe that the West Coast Health Alliance has our best interests for Lane County in mind, and really that's staying the course when it comes to childhood vaccinations and the requirements around vaccinations for school-age children in Oregon.
Anyone who believes they've been in contact with one of the measles patients is asked to immediately contact their healthcare provider and let them know they may have been exposed.
And people may have been exposed at Lebanon Community Hospital Emergency Department on January 6th and 7th, or at Albany General Hospital also on the 7th. Before seeking medical care, OHA says you should first call a healthcare provider or urgent care by phone to create an entry plan to avoid exposing others in waiting rooms. Last year, Oregon had one confirmed case of measles in the entire state. The case was confirmed in late June after the person had returned from international travel. But nationwide, 2025 was one of the most active years for measles since 1991. In total, there were 2,144 cases nationwide. Meanwhile, 2024 had the state's largest measles outbreak in more than 30 years, with 31 cases across the state, all in unvaccinated people